Welcome to this short webinar on the Arizona Medicaid coverage of physical therapy services. My name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to assisting physical, occupational, and speech therapy practices and facilities. Members can access a wide selection of guides and sample policies on Medicare, Medicaid, HIPAA, TRICARE, and more, and state rules and regulations that apply to therapy practices. Members can also email me at any time with any compliance or billing questions or schedule a phone call. Please visit the site at therapycomply.com for more information. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. On the website, we have more detailed information on outpatient and facility therapy services, fee schedules and code lists, billing for non-covered services, information on qualified Medicare beneficiaries, Medicaid managed care plans, and members can always request information or ask questions about Medicaid coverage and compliance. This presentation describes the Arizona Medicaid fee-for-service coverage of physical therapy. Medicaid managed care companies must offer the same amount of care as the state, but can change prior authorization, personnel, and documentation guidelines. MCOs do follow state rules in many cases, but therapists should always double-check with the managed care rules. Arizona Medicaid defines physical therapy as medically ordered treatments to restore, maintain, or improve muscle tone, joint mobility, or physical function, and to attain or acquire a particular skill or function never learned or acquired and maintain that function once acquired. Physical therapy services shall be provided by a qualified physical therapist or by a qualified individual under the supervision of a physical therapist within their scope of practice. Inpatient physical therapy services are covered for all patients who are receiving inpatient care at a hospital, nursing facility, or custodial care facility. Outpatient settings include, but are not limited to, therapy clinics, outpatient hospital units, FQHCs, physician offices, and home health settings. In order for physical therapy services to be covered, the services must be ordered by the attending physician, and the member must have the potential for improvement. The individualized plan shall be reviewed at least every 62 days or bi-monthly by the patient's primary care physician or non-physician practitioner. Inpatient physical therapy services are covered for all patients who are receiving inpatient care at a hospital, nursing facility, or custodial care facility. Outpatient PT services are covered for patients under the age of 21 when medically necessary. Outpatient physical therapy services are covered for adult patients 21 years of age and older, acute and ALTS as follows: 15 PT visits per benefit year for the purpose of restoring a skill or level of function and maintaining that skill or level of function once restored, and 15 PT visits per benefit year for the purpose of acquiring a new skill or new level of function and maintaining that level of function once acquired. Medically necessary physical therapy services for both restoration and acquisition of a new skill may be provided in the same contract year, but the limits still apply. A therapy service shall be reasonable and necessary to the functional development and/or treatment of the member's illness or injury. If the patient's expected potential for improving or restoring functional level is insignificant in relationship to the type and number of therapy services required to achieve such potential, the therapy is not covered for other than maintenance programs as described below. At any point in the development of skills or the treatment of an illness or injury, it is determined that the therapy expectations will not materialize, the services will no longer be considered reasonable and necessary. If the developmental or restorative potential is evaluated as insignificant or at a plateau, an appropriate functional maintenance program shall be established. The specialized knowledge and judgment of a qualified therapist shall be required to assess and establish the maintenance program to achieve the treatment goals of the ordering PCP or attending physician. After the member's condition has been assessed and the patient or patient's caregiver may be instructed as appropriate in the established maintenance program components, the services of the qualified therapist are no longer covered except for reassessments and treatment plan revisions. Outpatient physical therapy is not covered as a maintenance regimen. Authorized treatment services include, but are not limited to, the administration and interpretation of tests and measurements performed within the scope of practice of physical therapy as an aid to the patient's treatment, the administration, evaluation, and modification of treatment methodologies and instruction, and the provision of instruction or education, consultation, and other advisory services. For acute fee-for-service patients who receive physical therapy in an inpatient setting, the prior authorization for therapies is included in the facility authorization. No prior authorization is required for covered outpatient physical therapy services for acute fee-for-service patients. Prior authorization may be required by a managed care organization. Thank you for watching, and please visit the website for a lot more comprehensive information on physical, occupational, and speech therapy compliance and billing. Please like and subscribe. We'll be adding more videos very soon.